Hey, it's me. I know I'm doing another video like the next day, which I wasn't planning on, but I realized we're getting toward the end of March. We had a couple more days in March, and I have not talked about Blood Clot Awareness Month. I did do a video 3 years back, 3.5 years back, something like that, about my blood clot experience. Well, no, I did one 3 years back, and then I did one, I think, a year ago. So you can go back and hear about my experience, whatever, if you want to go back. So I just want to share really quick signs and symptoms of blood clot recovery. I post this stuff. It's like crickets chirping. Some people don't care, but I have had a couple people recently be like, "Hey, thank you for sharing." And one of them actually had a scare. She had a pain in her leg, and she's like, "I was wondering if it was a blood clot." And she went to the doctor, and they thanked her on being like diligent and like, "Oh, good for you for looking out for that." So I just want to share some symptoms real fast. Um, I had a pulmonary embolism, which is a blood clot in the lung. That was caused by part of it by injury. I was injured by a student. Did a video about that a long time ago. And then also I was a medication that could cause blood clots. So both of those combined, that's how you get a blood clot. My symptoms, well, let me share the symptoms first. I said symptoms of a blood clot in the lung. I'm on Blood Clot Recovery Network. Oops. Blood Clot Recovery Network. If you go on Facebook, there's a bunch of blood clot pages, recovery pages, stuff like that. So the first one is shortness of breath or trouble breathing, which is what I had. So basically, let's say you're just walking down the hall. You feel like you ran. You're like, and I remember I was like walking down the hall at school, and I was like, did I walk that fast? Because I do walk fast, but I was I was just walking, and it felt like I was running. The next one is chest pain, especially with a deep breath. I did not have that. So we have shortness of breath, trouble breathing, chest pain, especially with a deep breath, fast or irregular heartbeat, which I had. So when I would walk, my heart would beat like super fast, and then it would beat super fast. And I'm like, okay, what is going on? The last one, which I'm really glad I didn't have, it's coughing or coughing up blood. Yeah, obviously that happened. I would call 911 immediately. So what happened was, I had these signs for a couple days. Went to the doctor, and they told me to go to Kaiser because I went to like a small clinic. I didn't have my medication yet, so I mean my health insurance yet, so I had to go to like a small clinic, and they were like, "Oh, you need to go to Kaiser." So, I didn't. I did have my insurance, but it's just I was at a smaller clinic. I didn't really go to Kaiser yet. Um, but yeah, so they realized my heart rate was off, and they were like, "We need a chest X-ray, but we don't have that. Go to Kaiser." And the clinic wasn't open on the weekend, and they were like, "I wouldn't wait till the weekend." So I went in. That's when they told me everything that happened, and I was admitted to the hospital again. In the past, I've shared the whole story. There's another one called deep vein thrombosis, DVT. That's a blood clot that forms in the veins of the leg or the arm. So most time I hear about it being formed in the leg. I know there's a basketball player, Brandon Ingram. He actually got it in his arm. So yeah, let me share. Here's this. Okay, so the symptoms are swelling that often occurs in one limb. So swelling, and that's this girl I know, she had swelling and like a dull pain, and she's like, okay, this is weird. And then the next one is pain or tenderness that feels like a severe cramp. So swelling in one limb, pain or tenderness that feels like a severe cramp, and then skin that is warm to the touch. And then changes in skin color. So if it's turning red or purple, look out for all of that. Let me show this one more time. Again, you go on Blood Clot Recovery Network, all of that stuff. It's all on there. You can go look up blood clot on Yahoo, and it all pops up. This is just on Facebook because I follow recovery pages. So yeah, if you have any of those symptoms, go to the ER immediately. Unfortunately, some people who get blood clots, they die instantly because it travels really fast. Mine was in my lungs, and they believe it started in my pelvis because they were checking to see if it started in my leg, because sometimes it travels from the leg all the way to the chest, and unfortunately some people it goes to the brain and they die. I know we just said Haley Bieber, who's Justin Bieber's wife. She had, I guess, a blood clot to the brain. She had like a mini stroke or something. I don't know the whole medical thing, but that's just something to look out for. It happens in adulthood. There's not like really an age to it. One of the first stories I read when I went in the Blood Clot Recovery Network was a 22-year-old who literally just died. Healthy, would run, stuff like that, but she was on birth control pills and got a blood clot that way. So any type of symptom, again, let me show this one again. This is for pulmonary embolism, which is what I had. And then the DVT, that's the leg, or it could be the arm as well. So just thought I would share that real fast because I have shared it before. Again, kind of have crickets chirping when I share this. But a couple people recently, like I mentioned before, they were like, "Thank you for sharing that. I thought I had it, I didn't." Or they're showing me, like, "Oh, I had a relative who had that," or a friend, whatever. So just thought I would share that. I don't remember if I mentioned this yesterday when I went to my hematologist. Because they told me I can get off blood thinners whenever I want now. Because I've been doing blood work and checking my INR and stuff like that. Because I'm on blood thinners, warfarin. They assume I can get off whenever I want. Because of COVID, I'm not comfortable getting off of it. In case you guys don't know, many people getting COVID are getting blood clots. I just heard of 2 stories recently. A model got her legs amputated because of COVID. And then they had an 8-year-old who had all 4 limbs amputated because he got blood clots. There have been people getting fingers, hands, different amputations. COVID is not a joke. I know people keep thinking it's a cold. It could cause blood clots. So knowing my luck working in the schools, I told the doctor, I said, I work in the schools, which is a germ fest. If I go off of blood thinners and someone gets me sick with COVID, I'm twice likely to get blood clots. And they said, yeah, that's true. Um, for some reason, the doctors really didn't mention it. I've talked to 3 different doctors, 2 hematologists and 1 pulmonary doctor. And they're like, oh yeah, go off of them. And I'm like, but there's COVID, right? Like, it's kind of like they forgot about it. It's like, yeah, maybe we're getting COVID or getting blood clots. I don't want that. And also I told someone because one of my friends unfortunately got COVID on purpose from a relative. They had it and I thought, oh, no big deal. I'll go to a family event, gave it to their relative, and they got blood clots in their lungs and had to be admitted. They're on blood thinners and they're trying to decide when to go off. And I said, warfarin and any medication is a safety net. As long as I'm on any medication, I know I'm not going to get a blood clot. If I ever go off of them, I have to worry about it. Once you have a blood clot, you have to worry about it for the rest of your life. And I was telling my friend, even like if I travel, which I never travel, I haven't been on a vacation in 10 years. If I ever go on a plane, I have to have a care plan set up. So I have to make sure I'm wearing compression socks. By the way, everyone should wear compression socks when you're traveling, car or plane. They say wear compression socks because you're sitting for that long. And they have had people get blood clots, airplane rides and car rides. Just putting that out there. Compression socks. If I'm not on blood thinners, I need to do injections before I go. I have to have a whole care plan set. Everyone should wear compression socks and move your legs around. If you're driving, let's say 4 hours, about an hour, hour and a half in, if you need to get out and just stretch your legs real fast. And many people don't do that, and they learn the hard way. So, or even just move your legs around if you can while you're driving. Or not while you're driving, maybe like if you're at a stop sign, or even just pull real fast and just move your legs around to get circulation going. So I just want to share that real quickly for Blood Clot Awareness Month. Make you guys aware. Any signs and symptoms, please check it out. Don't wait because, again, some people waited and something happened. When I was at the hospital, they praised me because it was about a day and a half of it happening, and then I went to the doctor, and then eventually went to Kaiser the day after that. So I had this going on for like 3 days. And they said, good for you for going in and taking care of yourself, because they said they actually had a nurse who just died of a blood clot because she had symptoms for days and left it, and then she died. So I just want to share this real fast. I might do another vlog soon because I have a couple of things in my mind right now. I'll see. So I'll talk to you guys later, and thank you for listening to my blood clot awareness story. Thanks.